Thank you, Chairperson, to give me this opportunity to talk about this topic. I would like to change my topic to from Asia to Japan, and I have for the most of my career, it's about 10 years. I have no female colleague, and I have no experience in attending networking. So it will be my personal experience and personal view for the topic. I have nothing to declare. And let me introduce myself a bit. I was born in Japan and educated up to high school in Japan. And because of too much love to the country called United Kingdom, I went to University of Leicester. It's not working. Oh. Yes, in England, and I got graduated from there at University of Leicester. So, and after graduation, I went back to Japan to carry on my science degree and a master course, and then I ended up with entering a medical science school. So after becoming a medical doctor, I was been training in GI surgery first, about 6 and 7 years. Then things happened, and I had to change my department to cardiovascular surgery. And then I was allocated to a thoracic surgery department about 5 years ago. And this is me and my boss working in an open thoracotomy. So how many female thoracic surgeons in Japan do you think? We have more than 3,000 registered thoracic surgeons in Japan. And out of that, we have 245 female surgeons, which counts for 7.5%. And among female surgeons, we have only 6% of counselor of the society compared to the 26% of male counselors in the society. And 74%, including me, have no qualification of the board. So we are small in numbers. So how small are we? This is the percentage of the member of thoracic surgery in Japan. Pink shows the female surgeons. So you can see that in 30s, we have a greater number of the members of female surgeons there. So male to female ratio is increasing as the generations goes down. So the number of the female thoracic surgeons gradually, slowly increasing in Japan. So what we can do now? And this is the very sad news about the entrance exam for the medical school in Japan that came out last year. This is to exclude female students from the medical school to getting them a lower score in the entrance exam in the interviews. Maybe some say that they're female students are too good at communicating skills compared to the male students. So we got lower scores at entrance exams. So amongst them who failed in the exam, they were joking to one another, say that we failed because we are too good at communicating skills. Maybe it's not quite right, but we should say that in a society, but it is not custom to speak out that this is not quite right, things like that in Japan. So I feel really awkward to say that this is not quite right. Then I look back myself, my career back in the time I had to change my department. When I look at my male colleagues, getting more chance to go to the operating theater compared to me, and even my junior male colleagues have a greater opportunity compared to me, and he's got a certificate ahead of me. Things like this happened in my career. And looking at negative aspect wouldn't help really very much. And we have the patient in front of you, and we have to do the surgery in a calm mind and every day. So I got to the conclusion, but it takes me quite some time to get to this conclusion. I have to keep calm and carry on my practice. So to do so, I thought of myself that what can I do? Maybe as a surgeon, I have to brush my surgical skills. and write scientific paper, which is one of my headache these days. But and attending conference like this and meeting people and sharing their experiences, and when you give me this opportunity about talking about female thoracic surgeons especially in Japan, I thought of networking is rather important. I never thought of that before. This is the picture which was taken yesterday. This is the Team Asia from postgraduate master club team. I was teaching. I was in this team actually, and you can see that they're my friend. They're my friend. They're my friend. That's me. We have more female surgeons in Team Asia, which is rather good. So future perspective, in Japan, probably we have more and more female surgeons coming into the field of thoracic surgery. And as you know, that the number of patients diagnosed as lung cancer is still increasing. And at my institute, where I'm working as a resident, which is National Cancer Center in Tokyo, we have approximately 600 pulmonary resection cases per year. So to give us a good future perspective, I would like to be a good role model for junior doctors coming into our field. That is my conclusion that I got through. Thank you.